Hi everyone. This is the first section of my gluteal region lecture. In this section, I will talk about the bones and the related ligaments, and also I will talk about the hip joint. The gluteal region is a transitional zone between the trunk and the free lower limb. It overlies on the posterior aspect of the pelvis. It is a large prominent area over the posterior aspect of the pelvis, which extends superiorly up to the iliac crest, and laterally it extends up to the greater trochanter of the femur, and inferiorly the junction between the gluteal region and the free lower limb is indicated by a fold which is called the gluteal fold. The large prominence of the gluteal region is formed by the large gluteal muscles, which we call the buttock, and laterally this area extends over the hip joint and the greater trochanter of the hip bone, greater trochanter of the femur, and that is called the hip region. Gluteal region, physically this region is part of the trunk, but functionally this region is definitely part of the lower limb. Most of the muscles of the gluteal region are attached on the posterior lateral aspect of the hip bone. So see, on the lateral aspect of the ilium there are gluteal lines, the anterior, posterior and inferior gluteal lines. In between these lines the large gluteal muscles are attached. And the large cup-shaped hollow depression is called the acetabulum on the posterior lateral aspect of the hip bone. This acetabulum articulates with the head of the femur and forms the hip joint. Acetabulum has a semilunar shaped smooth articular surface which is called the lunate surface. Lunate surface is deficient inferiorly, that is acetabular notch. And posteriorly there is ischial tuberosity, and the ischial spine is a triangular bony projection, and superior to the ischial spine is the greater sciatic notch, and inferior to the ischial spine is the lesser sciatic notch. So this is the pelvic surface of the hip bone, and you can see the in between the ischial spine the greater and lesser sciatic notch. These two notches, these are converted by ligaments into foramens. So there are two strong ligaments in between the sacrum and the ischium. These are the sacrotuberous ligament, which extends from the sacrum to the ischial tuberosity. You can see this is the posterior view of the pelvis. So the sacrotuberous ligament is very strong. It extends from the sacrum to the ischial tuberosity. That's why its name is sacrotuberous. And the sacrospinous ligament that extends from the ischial spine, that extends from the sacrum to the ischial spine. That's why we call this sacrospinous. And in between these two ligaments, the greater sciatic foramen and the lesser sciatic foramen. And you know that obturator foramen is a foramen bounded by the pubis anteriorly and the ischium posteriorly. Obturator foramen is closed by a thin but strong membrane that is called obturator membrane. On the obturator membrane, it leaves a narrow canal, that is the obturator canal. And on the internal and external surfaces of the obturator membrane gives attachment to the obturator internus and the obturator externus muscle. So the greater sciatic foramen is the passageway for the blood vessels and nerve, and also a muscle. All these structures are passing through the greater sciatic foramen from the pelvic cavity and entering into the gluteal region. So you can consider the greater sciatic foramen as a door or the passageway for the blood vessels and nerve entering into the gluteal region. And the lesser sciatic foramen is the door or the passageway for the blood vessels and nerve entering or leaving from the perineum. The perineum, it lies here. So lesser sciatic foramen, through the lesser sciatic foramen, the blood vessels and nerves are entering or leaving from the perineum and this is a communication between the perineum and the gluteal region. The hip joint is a strong, stable ball and socket type of multi-axial joint. Is a ball and socket type of multi-axial synovial joint, and this joint is formed by the rounded head of the femur, and which articulates with the cup-shaped hollow of the which is the acetabulum of the hip bone. So the ball is the head of the femur, and the acetabulum is the socket. So this is a ball and socket type of synovial joint. Next to the shoulder joint, the hip joint is the most movable joint of our body, and our body weight is transmitted from the vertebral column through this hip bone and hip joint and body weight is transmitted into the head and neck of the femur during a standing position. The head of the femur, rounded head of the femur, is covered by articular cartilage, and except there is a central pit or fovea of the head of the femur, which gives attachment to a small ligament, which is the ligament of the head of the femur, and the rest of the articular surface is smooth. The rest of the articular surface of the head of the femur is smooth. And the acetabulum, I mentioned that this is the articular surface of the acetabulum, which is called lunate surface. Lunate surface is covered by the articular cartilage, and the margin of the acetabulum. The margin of the acetabulum is covered, or it gives articulation to a fibrocartilaginous rim, and this fibrocartilaginous rim is called acetabular labrum. Acetabular labrum increases the articular surface area of the acetabulum. And the acetabular notch, there is a ligament in between the acetabular labrum. This is called transverse acetabular ligament. Transverse acetabular ligament in the acetabular notch, and there is a small ligament of the head of the femur. And ligament of the head of the femur, its base is attached to the transverse acetabular ligament, and the another end of the ligament of the head of the femur is attached to the pit or fovea, which lies centrally to the head of the femur. Through this small ligament, the ligament of the head of the femur, you can see there is a small blood vessel is passing through the ligament of the head of the femur, and that provides a little bit of blood circulation, blood supply to the head and neck of the femur. The central part of the acetabulum is non-articular part, and that is actually that contains fat, and this part, non-articular part of the acetabulum, is called acetabular fossa. All synovial joints has a fibrous capsule. It is the synovial joints, one of the characteristics is it's covered by the joint capsule, which has an outer fibrous layer, and internally the joint capsule is lined by the synovial membrane, and the synovial cavity contains the synovial fluid. The joint capsule of the hip joint is attached superiorly to the margin of the acetabulum, and also it is attached to the anterior inferior iliac spine, and from this proximal attachment distally and anteriorly the joint capsule or fibrous capsule is attached inferiorly into the intertrochanteric line. Intertrochanteric line, it extends between the greater and lesser trochanter of the femur. So the joint capsule, the fibers are running from the acetabulum and anterior inferior iliac spine to the intertrochanteric line anteriorly, but posteriorly the joint capsule is not attached to the intertrochanteric crest. The fibers spirally crossing over the neck of the femur and is not attached to the neck of the femur, and it is going to attach to the root of the greater trochanter of the femur. So posteriorly, this posterior border or inferior border of the joint capsule is unattached, and it is just crossing over the neck of the femur. And the synovial membrane, protrusion of the synovial membrane may come externally outwards inferior to this unattached border of the joint capsule. The thick part of the joint capsule forms the ligament of the hip joint. The important ligaments of the hip joints are the iliofemoral ligament. Iliofemoral ligament, this ligament extends from the anterior inferior iliac spine. It is a Y-shaped ligament. See, Y-shaped ligament. And inferiorly, it is attached to the intertrochanteric line. Iliofemoral ligament is one of the strongest ligaments of the body. It prevents the hyperextension of the hip joint. There is another small ligament which lies anterior-inferior to the iliofemoral ligament, that is called pubofemoral ligament. It extends from the pubis of the hip bone and is attached to the anterior-inferior part of the iliofemoral ligament. And there is another ligament on the posterior aspect of the joint capsule of the hip joint that is called ischiofemoral ligament. This ligament extends from the ischium and the fibers going spirally over the neck of the femur and is attached to the root of the greater trochanter of the femur. The blood supply of the hip joint is mainly from the branches of the medial and lateral circumflex femoral arteries. The ascending branch of the medial and lateral circumflex femoral arteries, they anastomosis with each other around the neck of the femur. And from these arterial anastomosis, the retinicular arteries are small branches which goes inside the joint capsule and supply the head and neck of the femur. And you can see these are the retinicular branches of the medial and lateral circumflex femoral arteries. These supply the head and neck of the femur. The retinicular branches of the medial circumflex femoral arteries are more abundant. They are more, and the medial circumflex femoral artery is the main or major source of blood supply for the head and neck of the femur, because the medial circumflex femoral artery branches enter through the unattached posterior border of the joint capsule of the hip joint. And you can see here the medial circumflex femoral artery lies on the posterior aspect and lateral circumflex on the anterior aspect. Lateral circumflex femoral artery give rise to retinicular branches, but they are smaller in number and they supply less part of the head and neck of the femur than the medial circumflex femoral artery. And I mentioned that a small artery is passing through the ligament of the head of the femur, which connects the acetabular notch to the head of the femur, pita or fovea of the head of the femur. And this artery is a branch of the obturator artery. Obturator artery give rise a branch which is called the acetabular branch. It courses through the ligament of the head of the femur, and also that gives a little bit of blood supply to the head and neck of the femur. Hip fracture is common. Hip fracture means fracture of the neck of the femur. And fracture of the neck of the femur most of the cases it usually occurs in elderly women, because the elderly woman has osteoporosis. So, and that's why it is more common in elderly women. And hip fracture means fracture of the neck of the femur. And in case of hip fracture, this blood supply of the head and neck of the femur is disrupted. And in case of hip fracture, the acetabular branch of the obturator artery is the only source of blood supply of the head and neck of the femur. And you can see this artery is very small, so it is inadequate for the blood supply of the whole head and neck of the femur. Congenital dislocation is also very common in the hip joint, 1 in 5 in every 1,000 births. The major movements of the hip joint is the adduction of the thigh, abduction, flexion of the thigh, and extension. The flexion of the thigh, the muscles producing the flexion movement are the iliopsoas, sartorius, rectus femoris, also the adductors, the adductor longus, adductor brevis, adductor magnus. These muscles are the flexors of the thigh. The extension is mainly occurs by the muscles of the posterior compartment of the thigh. Those are the hamstring muscles. hamstring muscles are the extensors. Also, the gluteus maximus is also the extensor of the thigh. And adduction of the thigh, the adductor group of muscle or the medial group of muscle are the adductors of the thigh mainly. The adductor longus, adductor brevis, adductor magnus, gracilis, those are the adductors of the thigh. And abductors of the thigh are mainly the gluteal muscle. The gluteal muscles are gluteus medius, gluteus minimus, and tensor fascia lata. Those are the abductors of the thigh. And also there are medial rotation and lateral rotation occur. The lateral rotators are the deep gluteal muscles. Deep gluteal muscles, obturator internus, quadratus femoris, superior gemellus, inferior gemellus. Those are the lateral rotators of the thigh. And one of the major lateral rotators of the thigh is the quadratus femoris. And medial rotators of the thigh are the gluteus medius, gluteus minimus, and tensor fascia lata. And that's all for the first section. So I will talk about the gluteal muscles in my second part of this lecture. Thank you.